Hello folks, and welcome back to my channel. Today I've got another video that I hope is going to be helpful for both piercers and clients alike. We are talking about herpes and how that can affect getting pierced. So to start, let's talk a little bit about what herpes is, because a lot of folks are not aware. Herpes is a virus that's caused by the herpes simplex virus, and this virus can cause small sores or lesions to break out on the body. Most commonly, folks are familiar with oral herpes, although genital herpes also exists as well. There are two different strains that can cause herpes, HSV1 and HSV2, but these strains can occur in both areas of the body. HSV1 is known for preferring to live in the region around the mouth, and HSV2 prefers to live in the genitals, but depending on how you ended up getting herpes, you could have HSV1 on your genitals or you can have HSV2 on your mouth. Both strains cause similar outbreaks of small sores or lesions that typically go away within a couple of days to weeks and a little bit faster with medical treatment. Oral herpes is oftentimes known as fever blisters or cold sores, and a lot of folks get these and don't realize that it means that they have herpes. This is also in part because the herpes virus is spread through close contact, so you can end up getting it as a very young child from a friend or a family member who has a cold sore and didn't realize, giving you a peck on the cheek or on the lips. You can also transmit herpes even when you don't have any visible sores. So a lot of folks don't even know that they have it. They have no sores or outbreaks, but they're coming in close contact with other people and they're spreading it that way. Now, herpes does not do a very good job of living outside the body for very long, so you are not going to catch it from something like a handshake or a toilet seat. But if you did end up catching herpes, you would be one of 60 to 95% of adults who do have it. And this is from the studies Herpes Simplex published in 2009. This is one of the most widespread viral infections as far as STD goes that people end up with, and it's incredibly common to encounter herpes at some point in your life. I think it's very important right off the bat to say that there is no shame in having a herpes diagnosis. Again, 60 to 95%, that's a massive portion of the population that has herpes. In fact, statistically, it's more unlikely for you not to. So to those of you watching at home who have herpes, please know that there is literally nothing wrong with you for having it. It is incredibly normal, and it's nothing to be ashamed of. Now, that being said, if you do have it, it can impact your experience with getting body piercing, and there is a little bit of extra to know before you come in to get pierced, just to be prepared. Now, it's worth noting that this advice is primarily going to apply to oral and genital piercings, as those are the areas where you'll see herpes flare-ups the most often. You can end up with outbreaks on other portions of the body, but it's significantly less common and normally doesn't really play a huge role in piercings. So today we're really just going to focus on oral piercings and genital piercings. Like I mentioned earlier, if you've ever had a cold sore, or some folks call them fever blisters, that is a form of herpes. And you know that they can be pretty uncomfortable and definitely unsightly. No one's excited about it. But fortunately, with a little bit of over-the-counter product and a little bit of care, they tend to heal up relatively quickly. Now, one of the things that can trigger a herpes outbreak is the breaking of skin or the formation of a new wound. This is particularly relevant when we're talking about body piercings because we are breaking the skin and creating a new wound when we make a piercing. And this can trigger a herpes outbreak for someone who has herpes. And if you do, and you've had cold sores or you've had these outbreaks before, you know that they're pretty uncomfortable. So getting one of those on a fresh body piercing sounds like the worst case situation for many. The good news is there's lots of ways we can mitigate this. Now, while herpes doesn't have a cure, it does have some very promising treatments. Antiretroviral medications are medications that you can take daily that help reduce the viral load of herpes that you have in your body. This helps prevent the virus from shedding and helps prevent outbreaks from occurring. It even lessens your likelihood of passing herpes on to a partner. Now, this type of medication isn't for everyone. Obviously, you need to discuss with your doctor and your healthcare providers what's going to work for you. But if you're planning on getting a body piercing and you know that you have herpes, I would strongly suggest getting on antivirals, at least for the healing time of the piercing. For most oral piercings, this is going to be around 3 to 5 months. And for many genital piercings, it could be anywhere from 3 to 5 to 9 to 12 months, depending on what you're getting done and what your goals are. But being on antiviral medication, especially for the initial piercing and the first couple of weeks, is really going to help reduce your risk of ending up with a herpes outbreak while your piercing is still healing and in that more sensitive stage. Then, once it's a little bit more healed, if you don't want to stay on antivirals, you absolutely do not have to, but that will get you through that initial piercing phase and really minimize the risk of you getting an outbreak from having your piercing done. In the same vein, if you're currently dealing with an outbreak, it's not safe for us to pierce that area, even if it's not the exact same spot. So, for example, if you have a cold sore or an outbreak on this side of your lip and you want to get a piercing over here, we should still wait until that outbreak is fully healed, because chances are if we pierce while that is still present, it's just going to end up spreading to the area we're piercing. So if you do deal with reoccurring outbreaks in the area of the piercing, make sure you've got them fully healed up and gone before we pierce. And I would say give it a couple of weeks to a month of consistently no outbreak before getting a piercing, just to help reduce the risk of you getting an outbreak or a flare-up right around your brand new body piercing. Antiviral medication is absolutely one of the best ways that we can manage and minimize this risk. And if you are someone with herpes who's planning on getting some oral piercings or some genital piercings, I would discuss this with your piercer and your doctor. I would start by talking to your doctor and letting them know that there are piercings that you're interested in, and ask if your doctor has any specific advice for your situation and your experience with herpes about what you should do to prepare, or if this is a safe idea for you to get done. Most folks, just with some antivirals and a little bit of extra care, can get pierced with absolutely no problem, however. After that, I would speak with your piercer, and piercers should be educated to understand that this is no big deal. We should all have bloodborne pathogens training, we should all have viral and infectious disease training, and understand that there's really no major risks to piercing clients with herpes, especially not to us as practitioners. Really the only risk is you end up getting an outbreak on your piercing, and that would suck for you, but we should be here to guide you through it. Unfortunately, not every body piercer has this education and has this background, so you may end up dealing with some instances of discrimination, which I am so unbelievably sorry for. That should never be the case, and my hope is that as time goes on, more piercers will get educated about these things and learn how to treat our clients with better respect. Hopefully you're able to find a piercer near you who is respectful and does understand this and is happy to work with you. Depending on what your doctor suggests or recommends, they may suggest you take your antivirals for a couple of weeks or days before piercing, just to make sure you have them in your system. Others may say to start taking them day of piercing. I would listen to whatever your medical provider suggests. Beyond that, if you are getting a piercing and you have herpes, starting with simpler jewelry tends to be a little bit easier. It allows us to just focus more on keeping the area clean and monitoring it while it's healing. As exciting as it would be to start with a big fancy decorative piece like a giant opal or a big cluster, it's going to be a lot easier to start with something like a simple bead or a simple disc. These are going to be the easiest things to keep clean and heal with, and they're also going to allow us the ability to clearly monitor the skin around the piercing and just watch for any signs of a flare-up or an outbreak happening. Once the piercing is fully healed, we can swap to all of our fun, fancy decorative pieces. But I find over my experiences in working with clients with herpes that sticking with simple jewelry just really allows us to be extra careful during the healing process and extra on top of just monitoring what's going on. And that little bit of security and little bit of extra checking in can really make the difference in minimizing or preventing an outbreak from happening. And in general, just a little bit of extra care, so just really making sure you're staying on top of good oral hygiene while it's healing, staying on top of brushing, flossing, and rinsing is going to be instrumental. And likewise, when we talk about genital piercings, just staying on top of checking in with the area, making sure everything is staying clean, checking to make sure that there's no signs of outbreaks or things like that are all really helpful. And giving it a little bit of extra time before resuming sexual activity, which for some folks, vigorous activities can also trigger outbreaks. So giving yourself just a little bit of an extra window of healing to allow for that. The other thing is I always suggest using protection for the first month or so. If a client has herpes, I would suggest using protection for the full healing time, just to be extra careful and extra fragile with your piercing and other people's bacteria, but also to limit the risk of accidentally spreading herpes to a partner through bodily fluids surrounding your piercings or agitating the tissue and causing you to get an outbreak in that area. Now, all those precautions being taken, sometimes we do still end up dealing with an outbreak around a piercing that's still healing. And if that happens, it doesn't necessarily mean we have to remove the piercing right away. If the outbreak isn't immediately affecting the piercing or the piercing isn't super irritated, we can try gently treating it with topicals. There are lots of topical treatments for cold sores and oral herpes outbreaks that you can get at your local CVS, Walmart, Walgreens, whatever your local drugstore or pharmacy is, and you can apply those gently to try and help treat the outbreak. Even if you do end up with an outbreak very close or directly on the piercing, if it's not super severe and the piercing itself is still in good condition, you can again try and gently treat the outbreak and get that under control, and then try and get the piercing back on track for healing. Unfortunately, a lot of times if we do end up with an outbreak directly on a piercing, it does cause enough irritation that the piercing needs to be removed. We have to let it heal and let the area with the outbreak heal, and then we can see about revisiting the piercing later. But this is all going to be very situational on a case-by-case basis, and that's something that should be determined between you, your piercer, and your medical professional. When it comes to genital outbreaks, the same thing goes. Depending on the type of outbreak you're having, there are some topical medications that you can get from medical providers that can help with that, but same thing. Monitor it. If it's in a completely unrelated area, try and just get the outbreak under control and cross your fingers that it doesn't end up spreading to the piercing. Be really careful with cleaning and touching things in that area, but if it does get severe enough, the piercing may need to go and you may need to revisit it later. That's why the best approach when we're working on someone who has herpes is prevention, is taking those antiviral medications for the healing process to really help minimize the chance of an outbreak. That's the biggest thing that you can do. Starting with simpler jewelry, that way it's easier for us to monitor the area, it's easier for you to clean around it and make sure things are looking good, and also just really working one-on-one with your piercer and communicating with your piercer a little extra. For me, if I know a client has herpes, I like to do extra virtual checkups and just have them send me some pictures of their piercing weekly or bi-weekly just to check up and make sure things are healing well and they look like they're healing right. Because herpes can spread through direct, intimate physical contact, I also suggest extra hand washing steps and extra cleaning steps when it comes to taking care of your piercings, just in case there is any viral shedding in the area and we don't accidentally touch it and bring it over to our still healing piercing. So some of what that can look like for aftercare is extra emphasis on hand washing before and after cleaning your piercing. Extra emphasis on storing the tools for cleaning your piercing safely. So getting a little plastic Rubbermaid bin that has your saline or your gauze or your Q-tips or whatever the case may be in it, and keeping that tucked somewhere under a sink or out of the way, and only going into your cleaning supply bin with clean, freshly washed hands that haven't contacted any parts of your body. And just in case someone does end up having an outbreak or things like that, and if it's not directly in the area of the piercing, just for an extra measure of safety, using gloves when you're applying medication to your outbreak, just to help minimize the chance of taking any of those secretions and putting them on your fresh piercing. These specific aftercare tips are a little bit more situational, and a good piercer should be willing to work with their client and see what their client's situation is in order to figure out what's going to be the best aftercare and the best tips that they can provide in that situation. If I'm being honest, it's pretty uncommon that I need to use these tips because herpes tends to get milder as folks age, and with current antiviral medications on the market, I very rarely have clients who do have herpes deal with any kind of outbreaks or any kind of flare-ups during their piercing healing process. I also think it's incredibly important to mention before we wrap up the way in which getting piercings can be so empowering to someone who has herpes. Upon initially receiving your diagnosis, there can be a lot of feelings of anxiety, guilt, stress, and shame. And despite the fact that this is such an incredibly common virus, and there really is nothing to be ashamed of, especially when we look at the statistics of how many people have it, we still live in a culture where there's heavy shame and negative feelings surrounding things like STDs and herpes, despite how normal they are. Choosing to get a body piercing, especially in an area where you deal with herpes outbreaks, can be a very difficult decision for clients to make, but also an incredibly empowering one. Celebrating a part of your body that you have these feelings of guilt or shame towards, and the process of getting and successfully healing a piercing can do wonders for empowering someone after this diagnosis to remember that they are still a whole, wonderful, perfect person, that having herpes does not take away from that in the slightest, and that there is nothing to be ashamed about a medical condition and a virus like this. And the experience of getting and successfully healing it can be so wonderfully empowering for these clients to reconnect them with their body and remind them that they are so much more than just a diagnosis. Healing a piercing, of course, requires us to be in tune with the body part that we're healing while it's healing. And for many folks struggling with STDs and viral infections like this, it can be very hard to want to be present with the part of your body that you struggle with these outbreaks on. So doing so in order to get and heal a piercing can also be an experience that's mentally and emotionally healing for them in that connection with their body. This is some of the most amazing, powerful work we get to do as body piercers in helping our clients reconnect with and heal their relationships with our bodies. And as an industry, we should treat it like an honor to be trusted with helping these clients have these experiences with their bodies. And with proper bloodborne pathogens and safety techniques and protocol, there is basically no risk whatsoever to the practitioner when we're working on clients like this. We have the power to take an extra step in ending the shame and stigma that surrounds herpes diagnoses and STD diagnoses in general, and I frankly think that that's amazing. If you are a client at home watching this video and you have herpes or someone you love has herpes, I hope you know that you are beautiful and valid and that your diagnosis does not say anything about you as a person. And statistically, it's weirder for someone not to have it. And if you are a piercer at home watching this video, I hope that this helped give you a little bit of education on how to work with clients who have herpes and ways to approach piercing and healing them to have the best success of working with them to heal that piercing. As per usual, if you like this video and you like the content that I put out, please hit like and subscribe. It means the world to me. And I really hope this video sheds some positive light on things. Have a wonderful rest of your day. Bye.